wanted to see how these essays that I've written over the years actually fit in. I grouped them all together when I'd write, for example, on head injury or Alzheimer's disease or TIA or the elephant in the room about delirium. These are all kind of, well, that's what happened this week. That's what happened next week. But it turns out that about the first 7 essays in this book are actually all about head injury, about concussion, and what we've learned about that, about what happens in the military with head injury, what happens in boxing, what happens in other sports. So it turns out that there are some themes. I've always been interested in learning a little bit more. Even when I was in residency, if I saw a patient and we were rounding on the patient, it's like, well, let's talk about that patient longer. But there's 20 patients, 30 patients. It's like, well, 2 minutes, okay, next. That was very unsatisfying for me. So if I went home and I was to write a case report, for example, take a few days even of evenings to look up things about that patient, learn a little bit more, that I found very satisfying. So writing is an opportunity for me to take an idea or a thought and pursue it, and then try and structure it and see if I can make sense out of it.